Hi, I'm Dr. Tasman Cordy with Sage Nutrition in Little Silver, New Jersey. And I wanted to talk today about the top 3 nutrients from a functional medicine perspective we look for when we're helping patients with depression and resistant depression. The first 2 are actually a group of amino acids called tryptophan and tyrosine. And tryptophan and tyrosine are essential in terms of helping your medication work properly if you're taking a medication for depression, and they're also essential for the production of serotonin and melatonin. So if we don't have enough, we tend to not feel very happy, and we also tend to not sleep well, which is of course 2 main concerns with patients who have depression. There are about 4 different reasons why we wouldn't have enough of these 2 amino acids. The first is diet. You may just have an inadequate diet, you're not eating enough protein, so you can't get enough tryptophan and tyrosine out of your diet. The second is enzymes. You may be eating enough but not breaking down those proteins into tryptophan and tyrosine properly. And so you just have inadequate levels in your blood. A lot of times this happens as we age, and so people over 60, this is a good thing to look for. But we do look for it with patients of all ages, because if you have stress, if you have poor sleep, if you have other things happening in your system, we may have a low enzyme production regardless of your age. The third reason is because you're taking a proton pump inhibitor. So you're taking something that inhibits the production of hydrochloric acid, which of course is what breaks down proteins in the stomach and helps us digest and absorb our proteins. And so that would also lead to a low level of tryptophan and tyrosine. And then the fourth reason is because you'd have an infection in your gut, like a small intestine bacterial or fungal overgrowth. And if you have that, that would definitely inhibit your body's ability to absorb enough amino acids from your diet. The second nutrient we're going to look at is vitamin D. And vitamin D, fortunately, is a very easy nutrient to look at on blood work. And it's a very easy nutrient, or hormone actually, to supplement to get those levels up again. And the third we're going to look at are essential fatty acids. Specifically, we're going to look at the omega-3s, the EPA and the DHA. And when it comes to dealing with depression, we're more concerned about having adequate levels of EPA. And that's typically the one that's too low that we need to supplement to get higher. And that tends to feel better over time when patients have adequate levels of. There are lots of other nutrients, minerals, and other vitamins that we're going to talk about in other videos. But for today, if you're interested in getting nutrient testing done and you have depression, we can do a free consultation for you to just see if this is a good fit for you. Our number is 732-852-7752. Give us a call, and we'll set you up for a free consult and get to know you and see if what you have and what we have is a good match. Thanks. We'll see you soon.